So questions like this pop up in my DMs every once in a while, so I thought I might as well make a reel about it. I'm going to start off with a little bit of anger. Not geared towards any of you guys that have asked questions like this, more so geared towards society. As we have been a profession for over 100 years and nobody knows what we do. In grad school, we literally celebrated our 100-year anniversary of a profession, and that was back in 2017. So I'm going to try my best to explain this as simply but as effectively as possible. Occupational therapists help people become independent and confident in their daily occupations. Now, occupations can mean anything that's meaningful to the person. It could be swimming, dancing, lifting. Occupations even include ADLs. So activities of daily living just means self-care. Things like toileting, sexual function. The two primary functions of the pelvic floor, you guessed it, toileting and sex. So the three functions of the pelvic floor are peeing, pooping, and procreation. So anything that involves our urethra, our rectum, and our vagina. So that includes sex, that includes childbirth, and that includes menstruation. Well, oftentimes people will ask, well, what's the difference then between a pelvic health OT and a PT? Honestly, in the pelvic health world, there's not too much of a difference. What's different is the lens that we use to treat people. Say you go to a physician and you need a referral for a cardiologist. You go to the cardiologist, that person can be an MD or a DO. Now, they can both prescribe you the same things. They could be for different reasons, right? And both are still physicians, but they have a different lens. DOs tend to just be more holistic. MDs tend to be your standard physician. Same goes for pelvic floor therapy. We could prescribe some of the same exercises, but the lens that we use is going to be different. I'm going to be viewing it from a perspective of getting you back to being independent with your toileting and sexual function, and a PT is going to have a different lens. And the same goes for specialties like hand therapy. You can be a PT or an OT and obtain a CHT to treat people with hand injuries. Another example would be lymphedema. Again, same thing. You can be a PT or an OT and specialize in that field. Now, if you're somebody that's looking for a pelvic floor therapist and you don't know who to work with, it's not going to matter if they're a PT or an OT. What's going to matter is, do you vibe well with them? Do you feel comfortable talking about your pelvic floor issues with them? Because honestly, talking about your pelvic floor issues can be very vulnerable. And if you don't feel comfortable talking to that person or your provider, it's going to be a lot harder for you to get your issues treated. I love working with pregnant and postpartum women. I am South Asian. I live in Las Vegas. Sometimes these are just facts about me that people feel more comfortable working with me versus somebody else. At the end of the day, just find somebody that you resonate well with and you feel comfortable with, rather than just looking at what kind of letters they have in their title.